Hello friends, my name is Dr. Navnit. Today we are going to talk about when common becomes the characteristic. See, in our practice or in our study, we are trained to differentiate common with the uncommon or characteristic, and it becomes quite a habit for us to differentiate characteristic from the common. But sometimes we lose certain characteristic because they apparently seems like common. So it is very important to learn when apparently seeming common symptoms can be considered as characteristic. Let's see. First is intensity. By intensity, common symptoms can be considered or becomes the characteristic. How? Say for in example of hyperacidity, burning is quite common. But if the burning is so much intense that the patient got quite disturbed by it, and patient described his burning in a very peculiar way, so that type of intense burning becomes the characteristic even in case of hyperacidity, and you may not or you should not miss it. This is how intensity make the common symptom characteristic, and that can be applied to other type of sensation or complaint also. Another point is unexpected association. Now what is that? Can be considered as concomitant symptom also. Unexpected association. When your common symptom or complaint, which seems common to us, but when it is associated with those symptoms which are not expected to be associated with that particular complaint. So that association makes that common symptom a characteristic. For example, in case of migraine, one-sided headache is quite common. But when this one-sided headache is associated with certain type of mood changes, with certain type of changes in physical generals during episode, so that association, that pain with that changes combinedly, that association makes that common symptom a characteristic one. So you should consider that association together for your totality. Another is unusual presentation. Unusual presentation makes common symptom characteristic. Say for example, swelling or inflammation is quite common in certain type of clinical condition. But when that particular swelling or inflammation is being presented without pain, you can see the proportion of swelling and inflammation. So the pain is expected of that condition. But when the pain is absent, which is unusual presentation of that particular case, so thus the swelling or inflammation in quite a proportion without pain becomes the characteristic. So inflammation in itself may be a common symptom for that case, but inflammation without pain becomes the characteristic here. So thus how common symptom can be considered as characteristic with unusual presentation for that particular clinical condition. You need to see that. Another is a qualified aspect. For example, if you are having any complaint of headache, right? So the headache or pain can be a common symptom for that clinical condition, but when that particular headache occurs at a very certain point of time in day or night, say for example 7 p.m. aggravation or 3 or 4 a.m. aggravation, very sharp timings. So that particular association with that modality make the headache uncommon. So thus how the qualified aspect also make the common symptom characteristic. So these are the basic important points you need to consider while you are analyzing your case, and so you may not miss the apparently seeming common symptom which are actually characteristic. Thank you.